What are transference and countertransference in eating disorder therapy? Imagine sitting in a room, sharing your deepest feelings, and suddenly feeling like the therapist is someone from your past. That's often what transference is all about. In therapy for eating disorders, transference happens when a person unconsciously projects feelings or attitudes from important people in their life onto the therapist. These feelings might come from early experiences of criticism, neglect, or abandonment. For example, someone might see the therapist as a strict parent or a rejecting figure, which influences how they relate during sessions. Countertransference, on the other hand, is what the therapist experiences in response to the patient's projections. It's their emotional reaction to what the patient is feeling or expressing. This reaction can be conscious or unconscious and might include feelings like protectiveness, frustration, or helplessness. These responses are shaped by the therapist's own life experiences and unresolved conflicts. Both transference and countertransference are natural parts of psychodynamic therapy, especially when working with eating disorders. They give clues about the patient's inner world and how past relationships influence current behaviors and feelings. Recognizing these dynamics helps therapists understand what's driving the patient's struggles with control, self-esteem, and relationships. Therapists use awareness of transference to explore what the patient unconsciously expects from relationships and how they see themselves. This can reveal fears of rejection or feelings of unworthiness that are often linked to eating disorder behaviors. Meanwhile, understanding countertransference helps therapists manage their own emotional responses, so they don't interfere with the therapy process. Instead, these reactions can be used as tools to deepen understanding and build empathy. Because eating disorders involve complex issues like control and self-image, transference and countertransference can sometimes feel intense. Therapists need to stay mindful and reflected regularly to keep the therapy safe and productive. This ongoing self-awareness ensures the relationship remains a supportive space for recovery. In simple terms, transference is when a patient's past feelings are redirected onto the therapist without realizing it. Countertransference is when the therapist's feelings are stirred up by the patient's projections. Both are key to understanding the emotional roots of eating disorders and guiding effective treatment.